Well, good afternoon. My name is Rhonda Byrne, and I'm a social worker, and I've been practicing social work for about 20 years now. I first met Julia at a conference, I think it was about 6 years ago. It was at the Infant Mental Health Conference, if any of you are infant mental health people. And I heard Mickey and Julia speak about trauma and domestic violence, I think was the topic that time. It was at a workshop, and I really, really enjoyed it and took home the information and brought it back with me and, just kind of processed, wow, how much trauma plays a role, for pregnant women and so forth and so on. And about 2 years later, I went to another infant mental health conference and Julia's name was on a workshop again, and I said, I'm going. And that was when the SMC, the Survivor Mom's Companion, which is what she just finished describing, was about ready to be launched. And I introduced myself to her and said, I know you've got Detroit and Ypsilanti and Ann Arbor on your agenda, but how about some Western Michigan? How about the trailer in the cornfield? Because I'm from Fremont and Newaygo County, and I've got the pit bull that greets me at the door and the driveway that has a, yeah. You guys know, where it's, do I dare go down that driveway or not? Because I don't know if I'm getting back out, and anyways. So I've done the home visiting thing, and that's, where I got involved with this. And one other thing is this morning I was getting ready and I thought, I was born at Hackley Hospital. So it's kind of like, wow, I'm coming home. My mom worked at Reiche's when she was in high school, and so this is like hometown here. It's good to be back. Anyways, this is not my slide. Yes. Okay. My role now is with Newaygo County Mental Health, and I am a integrated behavioral health specialist, and I'm working for the mental health, but over in a doctor's office literally across the street. Family Health Care is just across the street in White Cloud. And we have found, you'll be hearing this more and more if you're in the mental health field, we're operating in silo systems. You've got mental health, physical health, and substance abuse. And right now they operate very independently. There are separate responsibilities. The locations are different. In Newaygo County, we really only have one substance abuse treatment facility. It's not even a facility, it's an office. In terms of, it's not inpatient, and that's Arbor Circle. And then we have mental health and a few private practice people that do other counseling services. And then there are about 5 doctors' offices throughout Newaygo County, and that's it. There's only one OB-GYN clinic, and that's with Spectrum. But what we've found is that, you've got your locations and nobody talks to each other. They don't work with each other. It's very separate, very independent. The treatment plans are different. The expectations are different. Prescriptions. If you're homeless, mentally ill, and sick all the time, where do you go for your primary care? ER is what they found over and over and over. And the scripts just get more and more confusing because you've got a psychiatrist over here, you've got a primary doc over here, but that primary doc's banning them from their office, so they go to another primary doc, and then they show up in ER 100 times a year or whatever. So, and get prescriptions there. The silos, again, are just very separate, and we need to integrate and we need to work together more and more. So there's the coordination. The burden of mental disorders is great. We know we can't do it alone. We need each other. It's estimated that people with mental illness die about 25 years younger than those without it. And these are the women showing up, and, and if their babies are getting off to a rough start too, that just, if we can help work together at this level of the, the prenatal care, just think about how much good we can do for those that are already affected, plus that baby that's coming into the world. I think all of us here know that mental and physical health problems are interwoven. It's hard to not be depressed. Like if you have diabetes, there may be some depression in there. 1 out of 4 people with diabetes are diagnosed to have depression. People with heart defects or heart problems, 1 out of 7 have anxiety. People with diabetes and heart issues often go together. So you've got the depression and the anxiety. The treatment gamut for mental disorders is enormous. If you work with the Medicaid population in particular, it's just hard to get the resources. It's difficult. I know from our CMH, if you don't have any insurance, then it's sorry. Sometimes we'll take you in, we can see you 4 to 6 times, but that's it. Primary care settings for mental health services enhance the access. I have seen this in my new role with CMH, that people will come in all the time to see a PA or a doc and say, I'm depressed, I need some antidepressants, and the PA will call me in and say, Rhonda, can you just kind of chat with this person and see what's going on a little bit? And then I'll gently suggest maybe some counseling or something might help. And they're like, oh no, I'm not crazy, you know, I'm not going there. So if we can meet them at the doctor's office for their OB clinic appointment or their gynecology, they're much more likely to be willing to listen to some of, you know, how this may help talk. Does that make sense? Okay. So delivering mental health in the primary care settings reduces the stigma and discrimination. I've already addressed that. And treating the common mental disorders in primary care settings is cost effective. In Newaygo County, there is no public transportation. So I'm thinking both from the business aspect of having the doctor's office, but also for the patient or the consumer or the client, whatever the title is. You know, for them to make one trip and get everything they need kind of taken care of in one setting, you know, if we can address this together in one shot, it's just so much more beneficial for them. And the majority of people with mental disorders treated in collaborative primary care have good outcomes. So it makes sense to work together, to have the different disciplines come together and focus on the patient. In terms of how I got involved, when I met Julia and the SMC model, you know, that whole educational component thing, that huge big study that Julia's been living for the last 10 years. Yeah. I was doing home visits. I was with the maternal infant health program. Gerber Hospital had a contract for that, and I was part of the team, the nurses. How many of you are maternal infant health? Anybody here? Okay. So I was part of the team, nurses, dietary, social work, all home-based, and when I heard her present and offer a tool to give to moms who are pregnant and struggling, you know them. They're the ones that skip their appointments. They have every excuse under the book, or they show up and they're totally miffed at the doctor because, and it may not even be the doctor, it's that nurse that looked at me funny, or, you know, or I'm never going back there again because they were rude to me on the phone. What else? You know the stories, okay? And I just thought, wow, to have something to be able to offer these patients. And so I took it back to the administration at Gerber, and they, you know, with some explaining of what I wanted to do and how we were going to do it, they approved it. And so I was able to dovetail the maternal infant health program and the SMC. And so when we did assessments, you know, that initial appointment kind of thing, you look for the red flags. How many times have you moved in the past year? That's one of the questions on maternal infant health. How many, help me remember this a little bit, you know, how many doctors, you know, kind of tell me your history of working with doctors and just all the red flags. Were you ever in foster care? Were you ever part of Child Protective Services? You know, that kind of thing. If those trigger, you know, for me, those are like red flag triggers, then I would offer to them the Survivor Mom's Companion and just say, would you be interested in doing this? It may help you as you go through this pregnancy, and just kind of gently introduce it to them. Now, one thing, Julia, is it still this big? When it came out, it was this thick. I mean, it's this huge, big 3-ring binder, and I would show it to moms, and they'd be like, no way. And it's okay. It's okay. We can break it down.
We were doing it on the cheap, but we were just printing on a single side of a piece of paper and sticking it in a binder.
In a binder, but it's big, you know, and they would just, you know, especially ones with low reading levels, they would just kind of freak out at first. And, you know, I just brought it down. It's okay. You don't have to do it all. We don't have to do it all at once, you know. But anyways, that's just one way. I was a maternal infant health program provider. Other home-based services might be able to just take this information and utilize it. Use it as you adapt it to what you're doing as you're working with families. Take this knowledge with you.